Here's a pop question. I'll give you a list of common health problems and see if you know what they all have in common. Chronic fatigue, anemia, asthma, arthritis, food allergies, gallbladder symptoms, and autoimmune disorders. Now, many people suffer with these conditions, and the symptoms are all very different. So what could they possibly have in common? The answer is a strange one. Hydrochloric acid deficiency. In fact, the more chronic the condition, the greater the chance of hydrochloric acid depletion. Check out this study. On a college campus, baseline levels of hydrochloric acid were taken on healthy college students. And before the experimental part of the trial could begin, the flu broke out on campus. Now this adds a twist to any hydrochloric acid experiment, such as sickness, because sickness will diminish the hydrochloric acid production. In an effort to salvage time and data, researchers decided to see how long it would take for the subjects to return to their baseline levels of hydrochloric acid after the flu abated. For the majority of the subjects, it took 2 months. However, it took up to 6 months for 2 of the subjects to return to normal. Now that tells me that there's a good chance that there's a digestive component with anyone who is battling chronic illness or trauma. Our stomach lining is geared for low pH, and we have layers of healthy mucus that line the gut to protect us from low pH. But if the pH goes high from fermentation of undigested foods, mild organic acids are given off, which can actually irritate our stomachs. The problem isn't too much stomach acid. The problem is not digesting our foods in the first place. Now I know this flies in the face of many of the commercials that you see on TV. But we have to understand that our stomachs were made for very, very strong acid. Let's look at the ways to assess hydrochloric acid deficiency. The Heidelberg test is considered the gold standard of hydrochloric acid determination. The procedure is to swallow a capsule that contains a radio transmitter which measures the pH of the stomach. It measures the baseline stomach pH, and then the stomach is challenged with a bicarbonate solution and timed to see how long and to what degree the stomach can recover and return to the baseline pH. What's interesting is that doctors who use nutrition as a means of therapy have found that symptoms are as effective as the Heidelberg test in determining the need for hydrochloric acid. In fact, some symptoms are often more important than blood tests in determining hydrochloric acid need. Symptoms like bad breath, body odor, a loss of taste for high protein foods, burning or acid stomach that is relieved by eating, gas shortly after eating, indigestion 1/2 hour to an hour after eating, but it can last up to 4 hours, difficulty digesting fruits and vegetables, often seeing undigested foods in your stool, and acid or spicy foods that upset the stomach. I can help you determine if you have a hydrochloric acid need, but if you want to click on the health quiz icon on my website, you can take the test for yourself and I will email you the results. Jonathan Wright, author of Why Stomach is Good for You, has tested thousands of patients using the Heidelberg capsule. He has the following telltale symptoms of low hydrochloric acid: weak fingernails that crack, peel, or chip, slow hair growth, heartburn, leg cramps, and nutrient deficiencies like iron, calcium, magnesium, folic acid, B12, B6, and zinc, just to name a few. After all, if we can't digest our proteins effectively, we will see slower protein synthesis in the areas which require protein and amino acids like nails, hair, and even hormones. How prevalent is low stomach acid or hypochlorhydria? Dr. Wright says that the range may go from 4% with patients in their 20s up to 75% in people over 60. As many as 30% of the people over 60 may have gastric atrophy. Dr. Wright's book reveals how we are increasing the population of bacteria like H. pylori and causing stomach cancers with the use of antacids when used over a long period of time. Now, of course, we don't want to give hydrochloric acid to people who we know have open stomach or esophageal ulcers, even though they may need it. We may have to heal the ulcers first. Also, if someone starts taking dosages of hydrochloric acid and it causes irritation or warmth, we want to stop the supplementation and heal the stomach lining first, and then go back to optimizing the stomach acid. If you're experiencing any of these symptoms, bad breath, lost taste of protein food, burning stomach acid, gas, indigestion, difficulty digesting fruits or vegetables, or undigested foods found in your stools, acid, spicy food upset, weak fingernails that crack, peel, or chip, slow hair growth, heartburn, leg cramp, or nutrient deficiencies like iron, calcium, magnesium, folic acid, B6, B12, and zinc, then you might need to supplement with HCl supplements.